So our next speaker is Dr. Devaki Nambiar, who's based at the George Institute in Delhi, and I think but does most of her work, I believe, in Kerala. And she's a health systems and health policy analyst. She's going to talk about how you translate evidence into policy.
Thank you, Simon. I'm not a sort of Teddy type person, so if you'll permit me, I'm going to stand like a tree trunk here and deliver my comments. I wanted to start off by thanking the India Alliance, specifically Suvira, Sara, Simon, Dr. Shahid, for giving me the opportunity in a little bit of curated space to talk about the kind of work I do. And my goal in a couple of minutes is to make it of interest to scientists whose work is vastly different from mine. And also, Simon has asked me to thread this through the earlier two presentations. So last night, I drastically reformed and changed my presentation for these reasons, and also because of some wonderful conversations I had yesterday with some of the people here. So if I'm not lucid, it's basically Simon's fault and the fault of others of you here. With that, let me just start. And I think it's useful in starting off by talking about some definitions, as we do. Let me see if I can get this going. Things moving. All right, here we go. So first, a definition of the word evidence, with something that we're probably much more comfortable and familiar with. Evidence refers to findings from the kind of research that we do, that we're aiming to be rigorously conducted. And I think the one distinction I'd make is evidence refers not just to Devaki's research, but the body of work that Devaki and other people in that domain do. So that's the one expansion on evidence there. Policy, and this is a definition from the political science literature, the definition is actually quite simple. Policy refers to decisions with a purpose taken by those with responsibility for those decisions. In the health sector, this could be the government deciding to increase incentives for frontline health workers, for instance. Another example of policy could, for instance, be deciding to fund research offices in government agencies deciding to fund that. And certainly these are things, regardless of our particular area of work, that we would want to influence. So I'd encourage you to think about policy as it relates not just to the impact of our research, but the functioning of it as well. Now, when we're talking about translating evidence to policy, there comes the word translation. Knowledge translation is actually very closely connected to the work that we in health policy and systems research do. But essentially, the idea is quite simple. It's this, and sorry about this very glib definition. We basically had a group of health policy and systems researchers together in the room, and we basically vented about all our failures and came up with this definition. But the key things here in teal are what I'd like to draw your attention to. And quite simply, knowledge translation refers to a situation where evidence is informing action in a systematic and transparent way. And the spheres of that action are in agenda setting, policy development, or implementation of that policy, right? So I'm hoping that that's fairly straightforward. The other thing, who is implicated in knowledge translation? I think it's important to talk about that. And it's a wide range of stakeholders. So it's everything from elected officials, politicians, to bureaucrats, public servants, partners and managers who will be responsible for implementation of policy, health workers in the context of health policy and systems research, patients and citizens, as Dr. Bang so passionately talked to us about. It's important to be able to communicate and translate what we're doing with those very, very key stakeholders, just as it is to speak and translate our work and our experiences and our knowledge to donors, because certainly that can change our ecosystem as well. So this is where we are at with the definition of knowledge translation. And in some work that we've been able to do, a key thing that we found is that these yellow sections are where researchers are falling short. So most of us are able to focus on trying to make our research of high quality, but really making sure that there is that local applicability to it. Again, something that Dr. Bang was challenging us to do yesterday. What does this mean for the community that I'm working with? Am I working with or am I working on a community? The other issue is, of course, of synthesis, and I mentioned this earlier. It's not just Devaki's research. It has to do with a body of research that will be relevant to decide what ought to be done. And finally, I think the bugbear for many of us, the cycles of research that we undergo are quite different from the cycles of policy making, right? So we need years and years, for instance, to arrive at some of our findings, and many policy decisions are made in split seconds based on larger political things that are happening. And here I refer to things like elections and other larger political, economic, and social realities. So, we are part of that larger ecosystem, and knowledge translation accommodates that, acknowledges that, and tries to integrate that with our research enterprise. We did a little bit of research on this idea of research embeddedness in health decision making. And on the left, you see a sphere that at its heart describes decision making related to health in this case. And you can see that there are myriad institutions that could potentially have an influence on what policies are made. And these are government supported, and even non-governmental institutions as well. And what we noticed in the study that we did a couple of years ago across low middle income and upper middle income countries across the world, actually, it was a qualitative study, is that a couple of things matter, and we grouped 4 of these together. Certainly the piece that everyone has been talking about ensuring that there is high reputation, high quality work being produced by you, your teams, your institutions. That is essential to be able to translate knowledge. That is the foundation of being able to be influenced and be listened to, be influencing and be listened to. The other thing is the capacity, and some of the capacities that Professor Aurora and our earlier presenter had talked about, of being able to communicate, of being able to manage research, of being able to lead. These are essential even for policy translation. And of course, the quantity and quality of connections that one has, we found, are important for policy engagement and knowledge translation as well. It could be something like having informal networks, as Professor Aurora also showed, or having a connection with a key player in your domain or area in which you want to influence policy shifts. I'd like to turn now a little bit to some of the influences and conversations that I've been having with people here over the last day or so. And a specific shout out to Dr. Purnima, who made my job actually quite easy by referring me to a paper that actually has 8 steps for how to do policy engagement. And I'm happy to share that paper with you and summarize some of the points. I'll show you all of the points and reflect on some of them in the context of my journey in health policy and systems research. Quite curiously, it's in a political science journal, but I feel that, as does she, that a lot of these messages are relevant for us regardless of the kind of science that we do. And so to start off with, the issue that I think keeps coming up and up again and again is the one of doing high quality work. You should have that reputation. That should be a core part of even a knowledge translation endeavor. But then come some of these additional ancillary pieces that feel like this is not what I do. But I think if we're looking to influence policy, as we should in our role as scientists, these things become important. I'm struck by another thing that Dr. Purnima said. She said that as scientists, if you're doing your job well, if you're doing number one, if you're doing high quality work, at some point or the other, you will be invited to influence policy. You think of Dr. Vijay Raghavan, you think of Dr. Bang. If you're doing exceptional work, you will have to influence policy. You will be invited to do it. And so in a way, I think thinking about knowledge translation is a way of planning for success. And as these 2 scientists suggest, that requires being able to talk about your research in lucid ways, the way Dr. Bang did yesterday, making your work legible and readable. It's also useful to try to understand how policymaking works. What does that ecosystem look like? For instance, in the last slide that I showed you, who influences what? Who are the actors? How do things work there? It's useful to be accessible to policymakers and try to sync up your communication with them routinely, flexibly, and humbly, as they suggest here. I think another key sort of tension, and maybe this is about personality types that is mentioned in this article, is are you an issue advocate? Are you concerned with advocating for your particular body of research, or specifically working on the domain, for instance, of tobacco control or protein signaling or something like that? Or do you want to take the position in the policy space of someone who's approached for all kinds of questions? So Devaki, this is not in your domain area, but what do you think as someone with a scientific temper? And I think we have to think about what is the kind of role that we would want to play once we're called upon when we're wildly successful in our scientific endeavors. The other thing is about building relationships. I think as we go along, there will be opportunities, particularly in fora like India Alliance, to build relationships with policymakers, to have those kinds of interactions, and we should take advantage of them. And also set some ground rules of things that we will do and that we won't. Another piece is about being entrepreneurial, taking some risks and putting yourself out there at times. I have to say I don't quite have the fortitude right now to do that, but they quite helpfully have suggested find someone who is. If that's not really, selling yourself is not really your approach, find someone who can do that for your cause and for your area of work. The last of these recommendations, I think, is especially important and something that I had conversations with many of you yesterday about. I think Dr. Bang's presentation provoked a great deal of reflexivity among our basic scientists, our public health scientists about, what am I doing and how is it making a difference? And to me, I think that's one of the most critical kinds of questions you can think about. And someone was telling me today that she had a conversation with even her husband, who's also a scientist, not at this meeting, about this. And I think that is absolutely critical, because that's how you decide the flavor, the degree, the nature of your engagement with policy. And I'm hoping in the next couple of minutes, as I talk to you about a bit of my journey, you'll think about how you would want to go through a process of similar reflexivity. And I dare say it's already started for many of us after listening to leaders the way that we have. I think, first of all, there's a useful metaphor. The research findings that I showed you earlier, the sphere and the circle, in that piece of research, we spoke to a senior decision maker from Thailand, and he said to me, and we were talking about research embeddedness, and he said, Devaki, to be a good knowledge translator, you have to be an amphibian. You have to be able to work in your domain of research, to be able to hop around and do productive work there. But you also need to be able to breathe, you need to be able to move around in the ecosystem of policymaking. And it's very important to straddle both of those worlds. I found that to be a very useful metaphor as we think about trying to enter that policy space and trying to see, can I breathe here? Am I comfortable? Can I go deeper into trying to engage with policy? Now let me just talk to you a little bit about, in my area of work, the kinds of opportunities I've had. So about 10 years ago, the erstwhile Planning Commission convened a high-level expert group on universal health coverage. And it comprised these 15 members who were really august personalities and really high achievers, leaders, if you will, in the sphere of public health. And you see the first person is sitting right here, Dr. Abhay Bang. And I had the great privilege of being a tadpole in the company of all of these frogs, people who were thinking about their research and what it means for transformation of the health system in India. It was an incredible, incredible learning experience for me. And I had a fairly small role in this of being in the technical secretariat. But listening to what was being said, how it was being processed, how logical arguments were being made about policy and political arguments were being made about policy shifts in the Indian context was incredible. And of course, in the years following this, universal health coverage has become a big mantra and a big theme in the Sustainable Development Goals. And in a way, seizing that initial opportunity, getting that mentorship, even indirectly from people, was able to give me great access to a trajectory in my own career. So I'm very grateful for that. And as I tried to advance this work on health reform and what does that look like in the Indian context, I work in the southern Indian state of Kerala. And my Alliance Fellowship actually looks at inequalities in universal health coverage at the state level. So I went to the Additional Chief Secretary, with whom I'd been familiar earlier, and I'd been working in the state for 3-4 years. And I said, sir, we are going to be looking at these inequalities at the state level with you. And he said, Devaki, that's great, but that's actually not terribly useful. I want you to drill down at the facility level. I want to be able to tell medical doctors who's getting left out in those areas. I want panchayat leaders to be able to come and talk about who's getting left out. And so you find that quite in the way that if you engage with communities, you can understand what their needs are. If you engage with policymakers, you can become sympathetic and relevant to the kinds of challenges that they face and the kinds of decisions that they have to make. And so this turned my research topsy-turvy. It changed my sample sizes. It changed even the nature of my work. But it was an incredible opportunity that I was able to seize and link up my work to policy change. So I'm very grateful for that as well. And I think the other thing that we were challenged to do, which was very useful, was to convene and connect local voices and action. So people across the health system, from frontline health workers to medical officers, I think in research we have an incredible convening power in terms of connecting what we're doing, which in some cases can be quite abstract, and asking people's opinion about what we're doing. And I think having those kinds of interactions really helps the system sort of see itself and start to become reflexive about itself in the way that we are about policy engagement. So I would encourage you to think about, you know, who are the people that I want to be part of the conversation of what I'm doing. And I know in basic science it's a little bit harder to do this, but I think when you, like a toddler, keep asking, well, why do you do that, and why do you do that, and why do you do that, you do at some point arrive at a set of stakeholders that are implicated in your work, who make a difference, and for whom or by whom policy needs to be shifted. So I think it's a thought experiment that we can all try, and something that we have been doing in our work as well. I think one of the other challenges that we've faced has been that impact is stochastic. It's very often driven by individuals. I mean, you look at the history of the Alliance itself, you can see that there are very highly motivated science leaders who have really crafted this institution and made it what it is. And this applies even to the work that we do in health policy and systems research, where you know, I've spent 3, 4, 5 years working with a bureaucrat. We're both frogs, excited about kind of each other's spaces and each other's roles, and then right as we're trying to start something, that person gets transferred. That is a ground reality of how policy engagement works. That's a ground reality in general, frankly, and will influence the way that you're able to make change in the policy space. And I don't think that's something to be shocked about. It's, I think, something to plan for. Finally, I think it's important to know our limits. One of the things that I have been confronted by in trying to do work in the policy space is that I don't really typically look like the kinds of frogs and amphibians that exist. There aren't too many women doing this kind of work. Not too many of them are social scientists. Usually they are doctors, and there's a different kind of authority associated with being a doctor. They're certainly not running off to take care of toddlers and rushing off right after meetings finish. And that will constrain my ability to influence policy. I'm well aware of that. And there will be circles to which I'm not invited. And this is shaped by larger structures, and it's important to sort of understand those limitations as they exist. So that's me, a tadpole. I'm hoping that now, as we have this opportunity to reflect on policy engagement, what it means, how does my work sort of connect to it, do I want to do it, how do I do it, that we can generate some interest in this group more broadly on this idea of policy engagement. And there are some of us already who've had a conversation informally about doing this and starting to create, so a group of frogs is called an army. I didn't know that, but I think what we're hoping to move towards is creating an army of frogs and tadpoles. And what we want to do, and I'd love your view on this, is that we want to have a couple of events, a couple of inspiring speakers like we've already had through series of events and interactions to provoke that kind of reflexivity, to help us think through this. In addition to that, I'm hoping that some of us who are much more adjacent to the space can have opportunities to build our own capacity and share lessons on how we're doing knowledge translation and what's working and what's not. And we've had some great support even from Wellcome Trust in the UK to start thinking about that. And finally, I think for those of you who are interested, it would be great to have some support in creating a sort of core secretariat, if you will, of people who are thinking about this strategy going forward. So I welcome your inputs and reflections on this, and I'll end with that. Thanks.
Thanks so much. Don't go away yet. Actually, it's so nice to hear this, because there's certainly at the organization where I work at Wellcome, there's so much emphasis now on sort of policy influence and translation. So it feels very, very timely. Are there any questions? So let's take questions now, and then we'll sort of move on to more general questions on the whole session.
So I don't know how receptive the health sector is for policy implementation, but I do know that in adjacent sectors like conservation and other aspects of research, well, biological research, ecosystem sciences, there's a much more, I would say, fluid engagement with policymakers and researchers. In the health sector, I think unless you're specifically a health policy, person, there's very little overlap. I don't know if you want to comment on that, or whether you've noticed any differences in the way engagement with policy that you encounter.
Okay, should I answer that? I think it definitely does differ by sector. But I think public health work is becoming increasingly intersectoral. And so the range of people and the types of people that are doing public health work, as we'll see, I think, in the next session as well, is widening. And I think where earlier there was very much a sort of hierarchy of people with medical training who were really invited to those spaces, that is sort of changing. And I think especially when there are resource allocation types of decisions being made, increasingly in the health sector, you want to hear the view of economists, you want to hear the view of a different range of types of expertise. So I think it's a sort of shifting environment right now, and I think we can also take advantage of the fact that there's a lot of international attention around this, and India is also trying to assert itself in this space in health. At least some bureaucrats are, some ministers are, and I think one has to be opportunistic about that. And sometimes it's just serendipity, to be honest.
Hi, just quickly to you mentioned about the gap between research and policy. I think one of the big missing bits is we presume that if we did, and I'm coming from a public health perspective, if you did a very good trial and you had some results and you had an excellent trial, now that will translate into policy. Even in the best case scenario, it doesn't, because policy requires you to scale up these things, and what you only have is a prototype, and you haven't actually worked out how this will scale up. And I think policymakers rightly are very skeptical to say just because you are able to do it in X amount of places, this will work across the board. And I think that's the next research gap which we as scientists or researchers need to really fill, is to say, if you're going to scale this up, these are the problems, these are the challenges, and this is how you address those problems. I think unless we do that, what we, effectively we have a prototype, we haven't actually tested it on the road. And we need to be able to say, here you can test it on the road, and now let's build a factory to build lots of these things. But otherwise, just going to them with a prototype and saying, oh, do this now, nobody's going to, no investor is going to put their money into it because you only have a prototype. Yeah. So that was one thing. The second thing is, while the stuff you did, that Nature paper, which Purnima pointed out to you, is very good, I think there's an even better one from LSE, which is a very interesting blog on tips for social scientists, how to influence policy, which I think I'm happy to refer you to because they were very practical when we do it. And the third thing is that I think policy is as difficult, the policy influence stuff is as difficult as or more difficult than actually doing a research project, because there are lots of things under your control. When you're trying to do policy, nothing is under your control. And as you said, the typical example, which is you work with someone for 3 years and then they disappear off.
Yeah.
I think these are challenges, but there are ways to address them. I really liked your talk, that's all.
Thank you. No, I mean, I think one of the first things that happens when you go with a study that you've completed and you say, this is possible, and I did this at this scale and I did this here, and they say, it was only possible because you did it at that scale, right? You did a pilot. Scale is a completely different issue, and frankly, in quite dramatic ways in the Indian context. And I think there's been a growing move to do implementation research and embedded research within programs. There's a lot of interest in trying to do that. And it's an emerging area of work. And I mean, for me, I'm sort of in the category of the converted. I do implementation research. So I think it's terribly important. But I think increasingly taking on that issue of scale and what does it look like in the everyday, the sort of features and characteristics of your research that you're trying to put in place. Do those work in the everyday? You know, when someone's had a bad day, when someone's, you know, having a difficult time, when someone goes on maternity leave, you know, how is your intervention getting delivered? Because that does happen. So.
Before I take the next question, could I invite the other two speakers to come back to the stage? Because I think it'll remind us all of their talks and help us to join this together. Yeah, wherever.
So Devaki, that was an extraordinarily lucid presentation. My main point was that one only, but one other thing that is happening now, especially in the health sector that was pointed out, we use surrogates, right, all the time, because you don't, like when Dr. Bang talked about yesterday, you actually had kids who lived and died, and you can make decisions based on that. But if you talk about nutrition, policy, health, we haven't figured out for decades what to advocate, simply because we're always using surrogate markers, and the surrogate markers may not necessarily be informative of the outcome we are looking for. And one thing that seems to be very important while advocating properly is what you pointed out, honest broker versus advocacy. Cognizance of the limitations of the field as well as strengths. I think when you articulate that with more clarity, things do a bit better. And of course, in some fields, technology is changing so fast that the time taken to get the evidence by the time the technology already changed. So AI and health is one of those interface areas. And we still don't know how we're going to go about it, but I think that's something worth thinking about, where tech continuously keeps on changing, faster than the speed of what you call high quality evidence. What will be the new paradigm of evidence generation for policy?
I would like to answer this. I generally do not use the words either advocate or broker. If I have to do policy translation, I need to have partnership with policymakers. And this partnership has to come in right when I'm conceptualizing the project. So implementation project has basically come in because it is embedded into the system and it is driven by implementers or program people or policy people. So that is, everybody then starts saying, okay. But the other research, Dr. Abhay Bang's research got translated at not only national but global level because it was transformative research. People don't do such research every day or are not able to do this. And that's why it is one of those landmarks. On the other hand, most of the time when we are doing anything, right in the beginning, if we do partnership. So we did injection safety study across the country in the whole 1 billion population. But as part of our investigator group, the national program managers were there. And we were not allowed to publish the report. The minister took me to the parliament and announced that the policy is changed. It was within a matter of 4 months because they were part of the system right there. So it has to be, I think, partnership rather than brokership or advocate.
If I may just add to that and say another thing. You're absolutely right. I think that relationship has to be there from the beginning. And I think what's been frustrating for a lot of decision makers is the fact that you show up right at the end being like, isn't this amazing? I got this finding from my one study. And they're like, no, in fact, the app that you have developed is like 14 other apps that people have come and presented to me. And what I need is a way of making sense of all of these apps. Can someone please do research on that? So again, knowing that that's at the forefront of a decision maker's mind is very important in terms of framing your own research and even the design of your research, because then you're starting to think about how interoperable the piece of technology is that you're developing. How does it link into the system? And I think that's, I completely agree with you, sir. I think that's absolutely essential to have that partnership. And there are caveats that come with that. So the department order that I have with the Kerala government does not allow me to publish or share any of my data without expressed permission each time I'm trying to put some information out there. So I have given up some of my agency in order to do this kind of linked embedded work.
Good, thanks. There's a couple of questions at the back.
Yeah, thanks, Devaki. I really hope that what you shared today slowly becomes kind of an agenda for this forum to discuss further. From my own experience, I mean, working at a line between researcher and an advocate, I'd just like to add a bit that sometimes it sounded that as if this is very technical, right, to influence policy. But I guess it has a gradient. And as a researcher, as bioscience researcher, maybe we start by publishing in the right journals and then maybe doing some sort of science communication. But if you are really into a core of influencing policy, it's also an extremely political process, right? It's not just technical. So I think part of it is about training and maybe picking up things. But more you are into it, I think there are also a lot of other things that institutions have to think, because there is also a risk which is involved, because there are a variety of interests which are also at play, right, in changing policy. And so I also know several institutions where there are such restrictions, where researchers really can't engage. And I would not say they are completely wrong, but they are mindful of the institutional risks that come with that new identity of whether you call it policy advocate or a broker and things like that. There's quite some confusion between the words lobbying, which is often regulated in many settings, to being an advocate or being a science communicator. And I really am not able to understand, how to really put them in boxes.
Thank you. It sounds like, I think it was, we can move on to the next question.
That side.
May I? This is to Professor Arora. I really liked your talk, and the question I had was, along with the program that you are conducting for leadership training, it need not necessarily be that all researchers or scientists can be leaders. We know from psychological perspective that each personality do have certain limitations. So in your program, have you embedded any personality assessments to see the strengths and weaknesses of a given individual, whether they have certain skills to be a good leader? They may be good scientists and good researchers. The second point is, especially in Indian setting, what I have personally felt is being leader is one, and then sometimes you also need to be the follower or be in a good team. So building the right team and having mutual respect to interdisciplinary work that happens. These are some challenges. I always feel that somehow the mindset is certain people or this can say, I can do everything. So I'm a psychologist, I'll do psychiatric related work, or I'll do imaging related work. It need not necessarily be so. So there's mutual respect for different disciplines. So 3 points, but all interrelated, I thought.
Yeah. So we are at the moment not doing any kind of a personality assessment. There are hardly any people. बड़ी मुश्किल से थोड़े से लोग हैं, whatever, who is available, we think some benefit will be there. So we do not, but the only thing is we ask them to write a short half a page why they would like to attend, and we don't charge any. It's a 15-day residential program. We don't let them go out of the place, and they interact, and so that's the kind of structure. Regarding the second and third point, I think that when you have to collaborate, when you have to partner, INCLIN has, today we partner with almost 252 medical colleges in this country. Currently there are 3 studies going on, each one is 20 plus partners. There is a saying कि अपनी हस्ती मिटानी होती है. When you are working with together others, you have to kind of really, partnership means equality. And in that case, even there is no PI, everything has to work, and that mutual respect comes spontaneously in that case. And again, this transdisciplinary partnerships are even more interesting, and I would say they enrich you much more. So as part of our leadership program, we have a central advisory group of about 10 people, and they are from 7 streams of various social sciences, medical sciences, and management.
Thank you. Ajit?
Yeah, thank you. I was very encouraged by what you said, Professor Orr, about the importance of partnership. And we heard last night from Dr. Bang about not just the importance, but the essentiality of partnership with participants and community. And you're talking now about partnership with policymakers. And actually, if we're properly joined up in partnering with communities with whom we do the research and partnering at the top level with the policymakers, then a lot of these problems and barriers simply melt away. And I just wanted to quickly share one example of innovation in the UK for partnership at that level with the policymakers, and it's this, that the public health service in the UK is called Public Health England, or PHE. It's well established. It's like the CDC in the US. It does a lot of its own research. And 6 years ago, the UK government, Department of Health, pulled away its research funding and put it out for competitive bid to universities, saying that the leading universities now have to bid for this money with Public Health England in partnership, and they established a dozen centers around the country, each one in a different area of public health research. I lead the one in respiratory infections. So on a daily basis, I'm deciding research questions in partnership with the policymakers in respiratory infection. So that way you know that whatever research program you're embarking on, it's actually what the policymakers need or what they feel needs to be addressed. It's designed from the bottom up, the research program, to address the unmet clinical needs and the unmet knowledge gaps in public health. So the international panel that evaluated all the bids, they all said from the different countries that they'd never come across a program like this. It's a sort of international experiment. First time it's been done to make a public health agency do its research with universities, in a sort of mandatory way. But I can tell you that it's worked very well, and and they're all about to be. There's a new round of competition with more fresh money, and I was just thinking, with so many key people in the room here today, it's worth being aware of that something like this is possible, and maybe such a thing could be possible in India as well.
I will just endorse that and add one other thing, that this, under this partnership, you can even do issues which are otherwise considered sensitive, either from a public health point of view, cultural point of view, or a political point of view. We are doing a study on HPV vaccine in Ethiopia and India with MRC and DVT. And in both the places, national program managers and the state program managers are part, and therefore we are able to do whatever we want as part of the study.
Let's just take two more.
If I could just, I had a question for you, Professor, and I also did want to say that this was a great example of a somewhat controversial area of work, but there is one risk, I think, in doing demand-driven research from the part of policymakers, and that's the exclusion of issues that they don't want to deal with. And I think it's very important, as you were saying, to use that convening role to make sure that there are opportunities for community-felt needs to also be articulated in some of those spaces. And there are innovations around that in terms of citizen engagement groups and patient representative groups being involved with research agenda setting. And I think in India that can take the form, the picture that I showed was Panchayati Raj leaders, some people from the community in the facility, the district medical officer, all actually just having a conversation. And that's what I meant about this convening role, because researchers can come off as actually quite friendly and allow for some of that power shift to happen. And I had one more question for you, Professor. We've been trying to do some work on women's leadership in health. And I'm trying to explain this to people as we go to very local to panchayat leaders and so on, and they ask me, well, what is a leader? And I'm just wondering what is your case definition of a leader in terms of the work that you've done? How does one operationalize that? What do you rely on?
Just a very short answer, because we've got one more comment and then we're going to finish. So
if I have to go to community, I think sometimes word leader is used more like a taxi without understanding the meaning. I think so decision makers or influencers, and I think Abhay can tell us, who has been there in the community, and actually encouraged by him, I am also in the community for the last 10 years now, that in community, as the day you start becoming part of the community, and then you immediately start understanding who influence. So although Sarpanch may be considered a leader, but there are a lot of other peoples who are considered, and many of whom are also called gatekeepers. So we need to, and you are a social scientist, so you understand it better, that we need to keep our eyes and ears open, and so not go by traditional just dogma.
Thank you, Dr. Bang.
A very mind-expanding session, and I must congratulate the organizers for having organized this session. All of us who are usually busy with our specific research projects in the labs, so from molecule to policy was a great jump. Now, I have two suggestions. One, Devaki, in this, from research to policy, there is one element which I have not been able to capture very correctly, but I know it is of extreme importance, and that's of timing. And there are ideas whose time have come. And there are researchers, projects, studies, very good studies, but unfortunately their time has not come. So that political timing is something is very difficult to capture, but the ultimate fate of the study, I would say at least 50% of it depends on whether its timing is correct or not. I would also say that in this policy, it will be good, useful for a research as to what does he aspire. Does he want a policy, or does he want his intervention to become a scaled up project, replication, or a program? And they are not all three. There are three different. So it will be helpful for a researcher, whether I want my research to become a policy or a program or a scaled up project. Narendra, your study is fantastic. I do not know any such study in Indian context. I would request you to take it further, and your question is path to leadership. But can we ask the question, path to successful leadership? Because after all institutions, leadership positions are occupied by Peter's principle, mostly by the incompetent people. And so, to define leadership by somebody who is occupying the position of the head might not be a very good way of. So, what are the characteristics of a successful leader? And I would request you to look at this book by Jim Collins, Good to Great. And he identified traits of some 15 corporations by taking those who have succeeded and become good to great in the past 15 years as compared to those 15 corporations who look potentially but who failed. So the question of control. So taking a control of not so successful or failed leadership versus successful leadership would identify what are the characteristics which decide successful leadership.
I will not go into the detail of this. The only thing is, for our study, being a head of the institution, department, or of an organization was not the criteria. And so there we have a lot of young people, assistant, associate professors, but who are not at administrative leadership position.
I think there's more to talk about next year when we come back. So can I first of all, thank you for very active participation, really fantastic questions and comments, but most of all to the panelists. Thank you very much.